Hi everyone, my name is Mia Gonzalez, and the contraception method that I will be discussing today is tubal ligation. Here is just a brief overview of everything I will be discussing in regards to tubal ligation. Tubal ligation, or more commonly known as tying your tubes, is a surgical procedure that provides a permanent and irreversible method of birth control. During the surgery, the fallopian tubes are cut, clamped, cauterized, or sealed to prevent a pregnancy. It is a generally safe and effective procedure with a 99% effectivity rate. And as you can see in this image to the left, these are going to be the fallopian tubes where the procedure takes place. Tubal ligation is a physical contraceptive method, as the alterations to the fallopian tubes distort the pathway from the ovary to the uterus. It makes it impossible for sperm cells to fertilize an egg as the pathway is sealed off. Additionally, tubal ligation prevents an egg from moving from the ovaries to the uterus. Since tubal ligation is a surgical procedure, a person will have to consult a physician to ensure that this is the right fit for them. The next step would be to set up an appointment, which is typically done laparoscopically. During the actual procedure, the patient will undergo general anesthesia. Gas is then pumped into their stomach to observe the anatomy properly. Following this, the surgeon will make small cuts to the lower belly, and a surgeon will use a laparoscope to locate the fallopian tubes. The surgeon will then cut, cauterize, clamp, or seal the fallopian tubes. Tubal ligation is extremely effective, with more than 99% effectivity rates. This means that fewer than 1 out of 100 people who have had a tubal ligation procedure will get pregnant each year. And if a person happens to get pregnant after a tubal ligation procedure, there is a high chance it can be an ectopic pregnancy, which is when a fertilized egg attaches itself to tissues outside of the uterus. The cost for this procedure varies from free to $6,000. Health insurance plans and government programs can determine if a procedure is going to be free, but if a person is going to pay privately, they can expect to spend about $6,000 on the procedure. The factors that determine price are the exact procedure method, the institution that performs the procedure, and different funding waivers that can reduce costs. There are several benefits to tubal ligation. The main one is that it is an incredibly effective method as it is permanent. It is also convenient and seen as a sort of one-and-done solution. It does not alter hormones as it is a physical barrier, and it can better a person's sex life. Additionally, there is research that shows it can potentially lessen the risk of ovarian cancer. Some disadvantages are that it is permanent. Reversals are incredibly expensive, complicated, and there is no guarantee that they will succeed, so patients must be sure before committing to this procedure. And although it is very rare, there can be surgical risks such as pain, discomfort, bleeding, infections, and ectopic pregnancies. Lastly, tubal ligations do not protect against STIs. To elaborate further, tubal ligations offer no protection against STIs, as their only purpose is to prevent pregnancy. People must wear condoms during intercourse in order to prevent against STIs. Tubal ligation is a surgical procedure that cannot be self-administered. A person must meet with an OBGYN or their primary care physician to confirm certainty. Then, the physician will take their history to confirm the operation is appropriate. The procedure is then done in most cases laparoscopically, or it can be performed during a C-section. The recovery is fairly simple since it is a minimally invasive surgery. Most people can go home the same day. Full recovery often takes up to 1 to 2 weeks. And here are my resources. Thank you for listening.